Hi, my name is Darren Garriga and I'm one of the registered psychologists here at Attune Health Centres. Today I want to share some recommendations from the Australian Psychological website. Obviously the coronavirus is having a lot of impact, and particularly on people's mental health. So today I want to share some of those things with you. With the outbreak of the coronavirus, it's normal to feel sad and stressed, confused, scared or angry during particularly a crisis time, and it's important that we learn how to manage our stress before it turns more severe into either anxiety or panic. So constant media coverage about the coronavirus can keep us in a heightened state of anxiety. So try to limit the amount of exposure we get and seek out more factual information. Some of the reliable resources can be the Australian Government Health Alert, or trusted organisations like the World Health Organization. So when we're stressed, it's easy to see that things are worse than they really are. Rather than imagining the worst case scenario and worrying about it, why don't you ask yourself, am I getting ahead of myself, assuming something bad will happen when I really don't know the outcome? But remind yourself that the actual number of confirmed cases of coronavirus in Australia is still extremely low. Ask another question: am I overestimating how bad the consequences will be? But I want you to remember that the illness is due to coronavirus infection, and it's usually mild, and most people recover without needing specialised treatment. Another question might be, am I underestimating my ability to cope? And sometimes when we're thinking about how we can cope, it's better to think about different perspectives so that we can have the best outcomes for that. So being proactive by following basic health hygiene is something that Dr. Anthony has already talked about here at Attune. And so I just want to reiterate some of those that are recommended by the World Health Organization. And they are to wash your hands frequently. If we can avoid touching our eyes, our nose and mouth. Stay at home if you begin to feel unwell until you fully recover, and seek medical care early if you have a fever, cough or experiencing breathing difficulties. One of the most important things that us as psychologists we work on is self-care, and to encourage a positive frame of mind, it's important that you look after yourself. Everybody practices differently, and if you have to stay at home, here's some examples you can use. Maintain good social connections and communication by speaking with family and friends via email or phone. Make some time for activities and hobbies that you enjoy. Keep up a healthy lifestyle by eating a balanced diet. Exercise regularly, get quality sleep, and avoid the use of alcohol, tobacco and other drugs to cope with stress. Practicing relaxation, meditation and mindfulness to give your body a chance to settle and readjust and keep yourself in a calm state. If you feel the stress or anxiety for you or your child is a result of the coronavirus impacting your everyday life, then a psychologist may be helpful. So psychologists are highly trained and qualified professionals and skilled in providing effective interventions for a range of mental health concerns, including stress. A psychologist can help you manage your stress and anxiety using techniques based on the most recent available research. If you're referred to a psychologist by a GP, you might be eligible for a Medicare rebate. You may also be eligible to receive psychology services via telehealth, so that you do not need to travel to see your psychologist. For more information, please go to our website. Thanks.